Welcome to our series, Understanding Cancer, the Truths, Treatment, and Myths with the John Wentworth Cancer Center, located on East Route 34 in Sandwich. Call the John Wentworth Cancer Center at 815-570-5006. Welcome back to our weekly feature here on WSPY. Our guest once again, Dr. Kevin Cater, radiation oncologist with the John Wentworth Cancer Center on East Route 34 Sandwich. Dr. Kevin Cater, how are you doing today?
I'm doing very well.
It's good to have you back out here once again. Today's topic, we're going to talk primarily about treatment options at the John Wentworth Cancer Center, aren't we?
Well, not just treatment options at the John Wentworth Cancer Center, but also how is cancer treated as a whole.
So all types of treatment options then?
Exactly.
Okay. Well, let's say that there's been a diagnosis of cancer for somebody. What are we looking at then?
So absolutely the first thing that needs to happen is the person needs to be staged. So we always stage cancer.
Right.
And so what staging does is it tells us not only where the cancer is, but where it's not.
Okay.
So we'll do a whole bunch of tests to determine both where it is and where it is not. And based upon the stage, then that tells us how best to treat it.
Okay. And at the treatment stage there, what are we looking at then? What various options are there?
So there are three broad ways to treat cancer. You can, number one, cut it out. You can, number two, give radiation. And number three, you can give chemotherapy. Okay. And all three different approaches have their advantages and disadvantages.
Okay.
So, for example, surgery, the main advantage of surgery is that the surgeon can cut out a big, bulky tumor and take it out of somebody's body. That's pretty remarkable. But the surgeon's scalpel is limited to how much normal anatomy that can be cut off without starting to affect function, and radiation, the fantastic part about radiation is that I can treat anywhere in anybody's body and kill cancer, and I can keep their normal anatomy intact. So I can literally get rid of a tumor in the middle of somebody's body and not have to cut them or lose any part of their body. The limitation to that is that we can't treat big, bulky tumors because it would take too high a dose of a radiation to eliminate something like that.
Right.
And then chemotherapy is great at treating throughout the body, but it can only handle what we call microscopic disease or small volumes of disease.
Okay.
It really can't handle large amounts of cancer. And what I mean by large amounts, big, bulky tumors, there are certain tumors that violate all those rules that I just talked about. So I talked about it in three kind of very broad sense, but the rules don't always apply. So there's certain, like a lymphoma can be very, very sensitive to chemotherapy and whatnot.
Okay, all right. And again, there are certain areas, let's say there's something in the brain you can't necessarily go in with a scalpel sometimes and surgically remove in areas around the brain there where maybe radiation and or chemo might help possibly. But again, you mentioned that it all depends on what stage and where they're at and where where it happens to be at in the body.
You hit the nail right on the head, yep.
Yeah, so in the time that you came into this profession in cancer treatment, have you seen anything or heard about anything that might be exciting down the road that is cutting edge or might be a space age technology, as I like to say, that might be something that might be a viable option besides the three that you've mentioned so far?
Yeah, the main one that is now driving advancement is what we call immunotherapy. So teaching the body's immune system to attack cancer. So by definition, cancer is cells that are growing uncontrollably that have learned to evade our immune system. So they are built, cancer is built to evade our normal immune system. So if you can teach the person's immune system to go back and attack the cancer, then that is much more promising.
So rather than weaken the immune system to kill off the cancer and weaken the person also, get their immune system to fight back instead.
That's exactly correct.
All right, real good. You've got an open house coming up. Tell us about that.
Yeah, so we have an open house. We'd love everybody from Plano and Sandwich to come on down. It's Thursday, March 21st at 4:30 p.m.
That's today. Yeah, it's going to run for a couple of hours probably, and should be a lot of fun. Again, the John Wentworth Cancer Center is on East Route 34 in Sandwich. If they want to contact you by phone, Dr. Cater, how can they do so?
Our telephone number is 815-570-5006.
All right. A pleasure talking to you once again, and we'll see you back here again down the road, okay?
Thank you.
All right. Dr. Kevin Cater, radiation oncologist with the John Wentworth Cancer Center in Sandwich. Join us next week for our series called Understanding Cancer, the Truths, Treatment, and Myths with the John Wentworth Cancer Center located on East Route 34 in Sandwich. Call the John Wentworth Cancer Center at 815-570-5006.